health and safety, building researcher practice partnerships in communities from the bottom up. We're really excited about our webinar today. This webinar is brought to you by the Center for Victim Research. Our aim is to promote access to victim-related research and to promote the usability of victim-related research. We are trying to bridge the gap between researchers and practitioners, and in fact, the Center for Victim Research is itself a partnership of researchers and practitioners. It's a partnership between the Justice Research and Statistics Association, the National Center for Victims of Crime, and the Urban Institute. The Center for Victim Research and this webinar are both supported by funding from the Office for Victims of Crime, part of the Office of Justice Programs at the U.S. Department of Justice. And with that, I'm going to turn it over to Janine Zweig, one of our presenters this morning. She'll introduce herself and her co-presenters. Janine, take it away.
Thank you, Susan. I'm Janine Zweig. I'm Associate Vice President of the Justice Policy Center at the Urban Institute, and I'm here with my colleague, Susan Popkin, who is Director of the Host Initiative and an Institute Fellow in the Metropolitan Housing and Communities Policy Center, and Elsa Falkenberger, who's a Senior Research Associate in that center, and Tia Newman, who's the Community Outreach Liaison for that center as well. Thanks for joining us today. The topics we want to cover on this webinar in this short time with you all is we first want to define a concept we uncovered during research efforts called coercive sexual environments. Then we want to talk about how we collaboratively built a project to address that finding called Promoting Adolescent Sexual Health and Safety, or what we'll be referring to as the PASS program. We'll then talk about how PASS is based in the community and how we're evaluating the program. So with that, I will hand it over to Sue to provide some background.
Sure. So the concept of a coercive sexual environment came out of research that a team of us were doing a long time ago now on the HUD's Moving to Opportunity demonstration, which was a program that randomly assigned households from public housing in 5 cities to getting vouchers they could only use in what they called an opportunity neighborhood, so basically a low-poverty community. And there has been long-term follow-up research on those families. And I came into that project having been doing years and years of research in public housing. When we got to the end, and the research showed that women and girls improved in terms of their mental health and their overall well-being, but there were no benefits for the boys, at least at the interim level, at the interim research. And that was a puzzle because I think when the research started, people really hoped we'd see a reduction in arrests and criminal behavior for boys and actually didn't really think about what was going to happen for the girls, honestly. And I took a look at that data and said, well, I've been spending a lot of years talking to women in public housing, and I'm guessing that what they're telling us is they got away and they feel better, and we were able to get qualitative research to talk to the families, to talk to the mothers and the kids, and that's exactly what the mothers and the kids talked about. And in fact, even the boys talked about that about girls, but it was very different in the new community, so there was a lot less pressure on girls. Makes sense? So I have a quote from one of the kids that we interviewed, which I think gives you a sense of what we're talking about. We have this clunky sort of term, coercive sexual environments, but this is really what it means. A girl like this saying, because they look at me as a little girl, so when I was in my former public housing development, they looked at me like a grown lady because I got body parts that men like. So then when I moved over here to a new development that was much smaller and much calmer, I noticed that people looked at me, they were friendly, and they know me as a little girl. I tell them I'm 12 years old, and they don't believe it, but I tell them I'm 12, they say I look like I'm 13 or something. So I just want to pause a minute. We're all familiar with the Me Too movement at the moment. This is not something that is unique to highly distressed poor neighborhoods. It's something that we know women experience across our whole society. But what we're talking about is a certain, and I'll talk about in the next slide, the way that structural factors intensify this effect for girls who live in these high poverty communities. So this is a graphic that is probably hard for you to see, but gives you a sense of that girls are at the core of this larger set of structures, and they're dealing with these structural issues, particularly structural racism, and segregation that has led to the under-resourcing of too many communities, where there are bad schools, bad police, where kids don't feel safe, their lack of strong local institutions, and that leaves the people who live in those communities coping with disorder, with violence, which we all know about the research on trauma leading to bad mental and physical health outcomes. So for girls, all of that is happening to everybody, and on top of that, you have to layer the pressure from harassment, from the expectation, like that little girl was saying, to be available as soon as they start to look mature, or maybe even before, and then also the victim blaming. So they're not supposed to, not only is this happening, but they're not supposed to complain about it. Next one. So we made a logic, you're all familiar with logic models on theories of change. This is from one of our research papers, actually Deneen developed this, to help us do some analysis to understand the relationship of CSE to mental health and other outcomes for kids. So if you look over there on the right, on the left, there's sort of the structural issues that I was just talking about and the gender-based violence. On the right are living in a community with high rates of sexual harassment, violence, exploitation of women and girls, where the kids are living in sort of a state of chronic female fear, and then you see these, we think, these poor social and health outcomes for women and girls. We developed 2 measures of CSE. One is for adults, and it's their perceptions of coercive sexual environment, and one is for youth, which measures their exposure to harassment, to seeing men abusing women. I think there are about 8 items in each of these scales. And we did an analysis, and we found this is a one-time survey, so it's not longitudinal, but we found a relationship to poor mental health for both adults and youth. But in addition to the fact that this was really our first exploratory attempt to use these measures, it's only been tested in 1 survey, and that was done in 1 low-income public housing community. We need much more research in a much broader range of communities to be able to assess variation, to be able to see what happens in a community maybe like a military base where we think there's a high level of coercive sexual environments, or colleges, or somewhere where there are more resources for folks. So that's one of our long-term research goals. And with that, I'm going to turn it over to Elsa to talk about the practical things we've been trying to do with this concept.
Great, thank you, Sue. I will provide a little bit of background, and then Tia and I are going to talk about the on-the-ground work that we've been doing. To provide a little bit of context and just history and background, often people have questions about how did we get to where we are now. So this slide provides a little bit of background. We, in doing the research that Sue was just describing, really wanted to learn more about coercive sexual environments by partnering with an actual community and to design a response, something that would feel concrete and hands-on to the community and not just like more research. So we built on an existing partnership that Urban Institute had with the DC Housing Authority. We had been working with them for years, but at the time, in 2010, we'd been working with them on a project called the Housing Opportunities and Services Together Host Demonstration, where we were working with them and local service providers in the Benning Terrace public housing community here in DC to provide wraparound place-based supports for residents. At that same time, we also received in 2011 a grant from the Kellogg Foundation. And Kellogg was really interested in supporting us as well as our partner at the University of California, San Diego, and the Housing Authority to work with the Benning Terrace community to really talk about what kinds of supports would they like to see for girls and how could we design something that would be based on past research and evidence-based practices that would work in this context. So we began doing some preliminary work there where we met Tia in 2011, and then we applied for a National Institute of Health NIH grant, which was a community-based participatory research grant in 2012. And that really provided us with the resources to do in-depth work with the community to design and pilot what we then came to label Promoting Adolescent Sexual Health and Safety. And we did several years of work there with that NIH grant, and one of the significant pieces was work with a steering committee which was made up of community members, local service providers, and somebody from the local MPD, Metropolitan Police Department. And we also worked with an adults community advisory board and a youth community advisory board to talk about the issues and also to build the program. So why PATS? How did we come up with this? As I was describing, we worked with various community members, and we have a quote here from one of our steering committee members, Coach PD, and Tia's going to read that quote for us.
Coach PD is one of the coaches who's been on Benning Terrace for about 17 to 20 years. So his quote was, I thought that, okay, here it is. You have one of these other big names or organizations just coming to say this is what we did in Benning, or we did something in Benning before. Out of all my years being here in Benning Terrace, in this community, trying to keep programs and getting resources for the youth here, I have ran into a lot of that. But Urban showed us otherwise. It wasn't nothing like we're going to give you all of this if you do this. It was nothing like that. It was straight structured for the youth. It was actually something we looked forward and needed.
Thanks, Tia. We actually have a publication online that presents a number of these quotes that you'll see here today that really provide the perspective of our community partners and what it was like to work with the Urban Institute on this project. So I'd love for you, Tia, to offer your thoughts on why you agreed to have Urban come to work with the Benning Terrace community in the first place, and what was it that you were really hoping to achieve for girls living in your community?
I was also new to Benning Terrace when I first went to be the resident council president for Benning. So when Urban came about, my urge was me walking through the neighborhood, talking to the young ladies. It was nothing there for them and the things that they had to deal with on a day-to-day basis, while in their home and all outside in the community with their other boys and stuff, concerning gang rape, molestation, and all types of barriers that they had to deal with. So when Urban came and how they were talking, they wanted to hear our voice and what was needed. That's why I was more interested in being with Urban Institute, because it was dear to my heart and it showed that they cared about what was going on and our voices was going to be heard and what the youth wanted out of this. So that made a big difference, and it was the youth involved. We had the youth cast, advisory board, so that was boys and the girls. We had the parents. So you had everybody's voice included in designing this program.
Thank you, Tia.
Oh, and sustainability. So that's the main thing, is trying to have sustainability with this.
And we'll make sure we touch on that again.
Yeah.
So one question, and I know a lot of the participants on this webinar are interested in, is why community-based research? And in that publication that I was referring to before, Tia actually had a really wonderful quote, and rather than having her rephrase it for the webinar, we thought we would just play that audio for you.
I think research organizations should be as kind of deeply involved with what's going on day to day on the ground.
Yes.
Yeah?
Yeah, I think you'll get better outcomes. I mean, that's just who I am. I'm thinking, you know, if you ain't hands-on, how can you sit there and just say, you just write down what somebody else report back to you for somebody taking notes, and then you'll be there and seeing it. And I think that that was a good thing for Urban this time, that they were so hands-on, so they really got to see it now. Maybe they can start dealing with, I ain't going to say every project, because every project is going to need that, but things that's dealing with communities and stuff, and yeah, it should be hands-on.
Great, and I think those of you who've joined us by computer can probably hear the quotes a little bit better than those on the phone, but hopefully everybody can hear that. We also wanted to add the voice of one of our other partners, Erwin Royster, and Tia's just going to read that quote for us as well.
People automatically feels like, oh, I'm a research subject now, I'm a lab rat. I wish you could say something else about it. I think that's a nice way to put it. Community-based participatory research is a community. We are all in this together. That's what it takes, teamwork.
Thanks.
So this comes to our first time we're asking for something from you all. We're wondering if you could participate in the poll we have here. Have you ever previously conducted community-based participatory research? The first response is yes, and I've been doing it for years. The second is yes, I've done it a little bit. The third is no, but I've done other forms of community-engaged research. Fourth is no, but I'm interested. And 5, no, not my cup of tea. So in the bottom right corner of your screen, if you all could take a few moments here to respond with that.
we go.
Okay. Great. So it looks like we have 53% of the participants saying that they haven't participated in community-based participatory research, but are interested in doing so. A smaller percentage of you have done it, and at about 18%, another 18% have said that they didn't do CBPR particularly, but have done other forms of community-engaged research. So thank you all for participating in that poll.
Great. And now we'd like to give everybody a little bit more detail. We know that there are a number of folks who identify as service providers and practitioners on the call. So to provide a little bit more information on what is PASS. It is a program, as we stated, that we co-developed with the Benning Terrace community and the University of California at San Diego, as well as a number of service providers and consultants here in Washington, D.C. PASS is a program that reaches both youth and adults in the community. There are 3 curricula that we use, 2 that we developed ourselves, which are Sisters Rising and Brothers Rising, and one that is a CDC evidence-based practice that you can find on their website that's called Parents Matter. Sisters Rising and Brothers Rising were created to empower teens to be critical thinkers so that they can make healthy and informed decisions about their bodies, relationships, personal development, self-expression, and identity. And the curriculum includes a number of different topics, planning, life planning, healthy relationships, sexuality, reproductive health, HIV, STIs, teen dating violence and intimate partner violence, bystander intervention, sexual harassment, gender and cultural norms, among other topics. And the groups are small group discussions of about 15 kids or less in each session, and they do role-playing, take-home exercises, sisterhood and brotherhood exercises, bonding, skill building, and at the end, a field trip to a local clinic in their neighborhood. And Parents Matter is an evidence-based program for parents and guardians of youth that aims to give parents the knowledge, skills, comfort, and confidence to communicate with their children and others in the community about sexuality and sexual risk reduction. Sisters Rising and Brothers Rising includes 10 sessions. They're 2-hour sessions, and Parents Matter we do in either 4 or 5 sessions, also in groups of 15 or fewer. And often people ask us, there are a number of reproductive health and topics that talk about issues around violence and things like that, but often these kinds of programs are really not comprehensive. And so you'll have one program on teen dating violence and another one on HIV, STIs, and another one on teen parenting. And so we really wanted to create something that was comprehensive. And so one of the most important things on the left you'll see is it engages community members as co-researchers and co-facilitators. So one of the things that the Adult Community Advisory Board and Youth Community Advisory Board, in addition to the steering committee, really emphasized was that they wanted members, trusted members of the community to be the lead facilitators of the program. And so when we originally started at Benning Terrace, we had a number, 2 to 3 community members paired up with a reproductive health expert. And in the girls group, they were paired up with somebody from the local DC Rape Crisis Center. And so now that we are several cohorts down the line in Benning Terrace community, the community co-facilitators are actually facilitating on their own. And so that's really a key element of the sustainability plan, as well as really building the capacity of members of the community to continue it, and increases the comfort level of youth in participating in the programming. It also makes sure, as we all know, as program providers, that kids don't just have needs and questions and desire for companionship and adults in their lives for 2 hours a week, as programs often run. They need it 24/7. And so by having members of their actual communities engaged in this way, they're able to reach the support that they need outside of programming hours. As I mentioned before, the PASS program embeds sexual health and safety in a broader wellness framework, so really combining comprehensively a number of the topics that kids do not experience in silos. And then finally, it meets teens where they live and not just in school. A lot of the programs that we hear about are implemented in schools, and there's a lot of good reasons for that, but we really wanted to make sure that this program reached a lot of kids who might not feel comfortable participating in school, who might not be as engaged in school, and also to be able to create a program that's implemented in a way where community context is really incorporated into the weekly sessions. If something has happened in their community that week, then they are able to talk about it. When they use examples, they're examples that are relevant to their neighborhood and community, and that really brings the program alive for many of the kids. On this next slide, Tia is going to tell us a little bit more. Picture tells 1,000 words, so Tia is going to walk us through what these pictures are.
The top left picture with the 4 ladies, the first 3 ladies, Coach Brenda Ponche and Ms. Danielle Hamilton, actually they live in the community and are the co-facilitators, and Dorinda is the health educator that oversees that, and that was the end of the group sessions, and there was flowers and stuff was given to them. The top right is when they did the survey data that they took from the kids, and we allowed the youth to do their own data and give the data walk. And we also have DCHA employee, Coach Petey, whose statement I heard earlier, and also one of the officers that works in our community, Officer Dan, and was also there to hear all the data and stuff that we received. In the bottom left is from Parents Matter, the first Parents Matter group of the parents of the community. And also the bottom right is one of our stellar youth that did the data walk and stuff. He was still giving the data information, answering the questions of the residents along with community leaders. Oh, everybody was there. So, and that's it.
Thanks, Tia. Sure. For those of you who are interested in hearing more about a data walk, we actually have a brief guidance document and a video to make it even easier for people who only have 3 minutes that walks you through what it is. The idea is really that there are lots of different forms of data that we have access to as researchers that often doesn't make it to the community, and a lot of rich discussions that don't end up happening because of that. And so anything that you can think of in terms of administrative data, police data on crimes and things like that, we have survey data because we've been implementing surveys in the community, but also qualitative data that you can have from focus groups and conversations, interviews, and even team meetings and things like that that we had through the community advisory boards. And so we tried to put together a presentation here that really allowed the kids to tell their own story. All of this data is about them, so we wanted them to be able to really lead in that conversation. And like Tia was mentioning, when you have such a diverse representation of different folks from the community, you really end up having interesting conversations that can range from the kids being able to have a conversation with the police about what they would like support or what they're experiencing, to a member of the DC Housing Authority understanding how they can support their residents beyond housing, and really providing for some rich conversations there that lead to some immediate small p policy changes and improvements, as well as programming.
Okay, thank you. And now this leads us to our second audience question we'd like you all to reflect on. This is, if you have conducted community-engaged research in the past, what are some of the methods that have worked well for you? And what are some of the challenges that you can share with all of us that you've encountered? We're going to give you the opportunity to respond to this while we continue our conversation around sustainability, and then we will look at the kinds of feedback we're receiving from folks.
Great. And I think everybody will be able to see some of the responses that are coming in, so I think that's great that we can see each other's responses. It may end up being a distraction for some, but we'll keep moving, and then we'll make sure that we get a chance to recap some of those after this. So just one final slide on the topic that Tia brought up is really on sustainability. Julia Irving is the former community outreach coordinator for the Metropolitan Police Department in DC. And so we're going to start off by playing her quote, and then I'll come back to Tia with a few extra questions.
My concerns were just that programs come on the property every year. And they may stay for 5 years, they may stay for 5 days. And the community just wasn't enthused any longer. They had no desire to be engaged by any other service provider because so many times their hopes have been listed only to be stomped on because the program runs out of money or somebody leaves the job and the new person that comes in doesn't facilitate it the same and then it goes away.
Great. And Tia, I'd just like, since you're here with us, to hear a little bit more about when you talked about sustainability before, what does sustainability really look like to the community?
People that's there with compassion, and that's going to stay there, not the coming in and coming out, because that's what they're used to, people just coming in and leaving back out, and they get used to you and close to you, and then you like disappear. And don't switch staff, because that's a big problem. They used to one staff, and then come another staff. A few weeks later, then another staff, a few weeks later, they lose their trust in what you're trying to offer. So I know for Benning, the staff that's been there, we've been there now for 7 years, so, and it is also the community people, so they're used to them.
Yeah, just as an example, you know, we talked about Coach Petey before, and Tia said he's been in the community at least 17 years. You know, most communities do have a few people who are like that, not all will, but that was what was really important, is that many of the members of our original steering committee and some from actually the Adult Community Advisory Board ended up being the facilitators of the programming. And had we just hired consultants or asked for a local nonprofit to be our service delivery, those folks would not still be there beyond the term of a grant. And so here we are several years later, 5, 6 years, almost 7 years down the road, and so we're still we still have the original co-facilitators of the program who are working with us. And one of my commitments as a researcher to the community was saying, being really clear about how much money we had and the time, the period of performance of the grant, and never making any promises that we could definitely go beyond that, but definitely giving my word that we would try to find additional resources to build sustainability for the program that they envisioned and that they wanted. And so in Benning Terrace, we were able to get a grant from the DC Department of Health, and that is why the PASS program is still alive and running and actually being refined iteratively. So it's not just a static program, it's something that we're constantly working with the community to work on, to improve. Janine, I don't know if you can.
Yep. So it looks like we only have one response to our questions so far, but it was really with a focus on community partnerships. And so this person responds with, working with a trusted community partner has been most helpful for us coming from the researcher side of things. It's critical to start with an agency already on the ground who has the key connections you need to do the work well.
Sure. I can't say enough about this, but I will try to keep it short. There's a really interesting distinction to be made. We often use the term community-based organization, and I think that this means a wide number of different things, and we can just really see that there are some organizations which some might affectionately or not so affectionately refer to as mom and pop shops, and I think that really takes away from the extreme level of expertise and value that those organizations have in the community, and partially because of the sustainability issue that we were talking about, but also because of the kinds of relationships, the connections, the understanding of what people want and need, and the way in which they can implement their work is done in a way that's respectful of the community, that really reflects the desires and needs, and that really incorporates community members as experts themselves. And so we've been able, since moving on from Benning and working in other communities, to really see in terms of outreach and recruitment what a difference that makes, in terms of the kind of feedback that they can give us on the research tools like our survey and the kinds of questions that we ask, how we analyze the data, and also how they really are always thinking about how to build the capacity of community members to engage both in the research, the programming, and to make that additional difference in terms of civic engagement, the policy portion of goals that we have.
And one of the things I think is interesting about this particular process is, to your point about building capacity among community members, is that therefore the sustainability lives on within the community itself as well. So not just the commitment from the larger organization that came to the neighborhoods, but that empowering community residents to continue on themselves as well, because you've built capacity there that can be longstanding and translated into other programs or contexts or things like that.
Absolutely. Yeah.
Anything more? Yeah. Okay. All right. Now I want to talk a little bit about what is now our next stage with the PASS program, which is through funding from the Administration for Children, Youth, and Families, we are now conducting a quasi-experimental study of PASS programming, again in the DC Housing Authority neighborhoods, but in a much wider array of neighborhoods than the Benning Terrace community. So the research questions that we're trying to answer through this evaluation are, do participants in the PASS intervention compared to the comparison group exhibit greater knowledge on sexual health and safety issues, greater positive attitudes and adhere to more positive norms, and more positive behaviors with regard to reproductive health and safety? Specific to these questions are really three key outcomes. The idea that by changing knowledge, you therefore can influence attitude, which then in turn will influence behavior. And so in the knowledge area, we're really trying to give youth an understanding of what is coercion, what is consent, and what is sexual harassment, so that there's an understanding of what's healthy and not healthy, and then bringing that to bear on what's really about what are traits of a healthy relationship. So not just those issues in the community, but also within a particular dating relationship. We also provide them with sexual health and health knowledge around anatomy, reproductive system, contraception, conception, pregnancy, STIs, HIV, etc. The attitudes that we're trying to influence are instilling a positive outlook toward your future, a rejection of unhealthy relationships once there's an awareness about what is considered to be healthy traits in a relationship, influencing gender norms, and improving attitudes toward contraception use. And finally, what we're hoping that translates to is behavior. And so that is things such as positive bystander response to sexual harassment, coercion, and assault, a decrease in teen dating violence behaviors, including psychological abuse, physical abuse, and sexual coercion, an increased use of health services, communication about sexual health with partners, etc. And for the current study, this is our evaluation design, which is pretty complicated, so I'll just kind of walk through superficially what we're trying to do. But we're working with 8 communities total. In 4 of those communities, we are, in fact, implementing the PASS program in the way that Elsa described earlier, with a community-based organization and community residents working together to implement the program. So they'll be implementing a program cohort that has 15 girls and 15 boys, so 15 girls participating in Sisters Rising, 15 girls participating in Brothers Rising. And each of those cohorts of programming will involve 4 rounds of surveys. So we're conducting a baseline survey before the program starts, an immediate follow-up after the program finishes, after the 10 sessions are completed, and then 3 months after the program finishes, and then 9 months after the program finishes. We're going to be doing that 4 times in 4 communities, and then another 4 times in another 4 communities. In addition, we'll be conducting alternative programming in our comparison sites. And so this is what we would call an intentional control group design. So instead of the other youth in communities getting no programming whatsoever, what's being offered is a community-based provider is offering other kinds of youth programming. So for example, we have 1 set of communities in the comparison sites receiving substance abuse prevention programming. The idea here is that many of you are aware that a lot of the effectiveness around youth programming, it's been found, is really the nature of the effectiveness is the relationship built with the program providers. And so that caring and supportive relationship that youth feel after a program or as part of a program ends up being what's driving the findings. We wanted to understand the effectiveness of PASS above and beyond that caring, supportive relationship they develop with the program providers. So the youth in both the PASS program sites and the comparison program sites will be having that kind of nurturing relationship happening in programming, but now we're really able to test the curriculum itself. Is PASS curriculum effective at achieving the outcomes that I described in earlier slides? So we have a number of next steps that we are interested in making sure this line of research continues and that we can learn more about these issues and be more helpful in more communities. And so the first area that I want to talk about is continuing to build our research base that focuses on coercive sexual environments that Sue spoke to earlier in our conversation. The first thing we really don't have an understanding of, but we hope to build our knowledge in, is really understanding the nature of coercive sexual environments across contexts. And by that I mean, does this concept differ in different neighborhoods or contexts, or is it really the same? Are there different types of coercive sexual environments, or does it just vary in severity? These are questions we really haven't answered, and as Sue acknowledged at the beginning, with the Me Too movement, you know, girls in general and young women and women in general experience coercive sexual environments in a lot of their day-to-day lives. And what we want to understand is, what does that look like across different contexts? We also want to understand really what are the negative effects of experiencing a coercive sexual environment above and beyond the effects of living in neighborhoods of concentrated structural disadvantage. And so, to Sue's point earlier, the girls we're currently focused on are girls who are living in neighborhoods due to structural disadvantage, and policies over the decades have exposed them to different kinds of environments, and we're wondering, you know, what does CSC mean on top of those other experiences? And so really trying to isolate the effects of a coercive sexual environment.
Yeah, I think I would just add that I think we know the boys are living in the same community, right? But we think that, and that they're experiencing the same trauma and the same kinds of things are happening to them. We know there's been a lot of research on what happens to boys because of, you know, physical violence, shootings, gang violence, and a lot of focus on the boys. There's been a lot less focus on what the effects are on the girls and how those kind of effects play out. So the girls are experiencing the same things as the boys. They also have the rape culture to contend with. How does that affect their outcomes?
The other piece that I would want to add about boys is sort of the negative, trying to understand the negative effects of the coercive sexual environment dynamic, that they're pressured into potentially playing a role in this that they themselves aren't interested in playing. And so, you know, the fact that we have both Brothers Rising and Sisters Rising in the PASS program, it'll be important in our evaluation to understand if we're also addressing some of the needs of boys at the same time.
I mean, unhealthy relationships are bad for kids.
Unhealthy relationships are bad for kids in general. All
orientations. And
yes, yes.
And I think really our goal is to figure out how to help kids have better outcomes.
That's right. The other line of research that we think needs to be expanded, and we haven't been able to touch on quite yet, but hope to in the future, is really trying to understand what works to protect girls from coercive sexual environments. So what features of a girl's life or relationships actually protect them against any deleterious effects of living in a coercive sexual environment.
And that relates to what I was saying at the beginning, that if we could look at this across different contexts, in a college, there's a lot of resources in most colleges and universities for kids. There's counselors, there's teachers, there's, you know, other kids, there's their parents. And so how does the response differ? How does their recovery differ if something bad happens? I mean, all those kinds of things we need to understand more about.
Another area for next steps is to draw attention to policies to support young women and girls of color in particular. Some ideas around that are national campaigns aimed at policy and systems change that can reduce the impact of sexual discrimination of all women, and then in particular women and girls of color. An example of this would be some of the campaigns promoted by the National Crittenden Women's Foundation.
And the National Women's Law Center that just released a report this week on differences in discipline for girls of color in the DC public schools, so that viewing girls of color as older than they are, or expecting them to behave as older than they are, punishing them more harshly, and then, you know, because of the legacy of segregation and discrimination, the over-sexualizing of girls of color much younger. Right, because critical of that report was about a major focus of it was the clothing girls were wearing. The hair they're allowed to, hairstyles they're allowed to wear, and girls of color getting disciplined for wearing the current off-the-shoulder styles while their white counterparts were allowed to wear them and nobody said anything. And so I think that's the context in which all these other things are happening. And finally is our idea to continue doing programs like PASS, so creating place-specific, sustainable programming and refining models that can really lead to lasting partnerships with community members so that these programs can stay for the long term. Any other thoughts about that before we open up for questions? I guess the one thing I would add, this is not the only program like this we're trying to develop with kids and communities right now. We're also doing with teens around food insecurity in communities where there's a lot of food insecurity, and having the teens, similar to PASS, giving the teens a leadership role, having the community co-facilitators. So I think this is community-based research can be used for multiple purposes, CVPR. Right. I think the last thing that I would want to add too is that we didn't mention is that as part of this project, all of the researchers and practitioners have been trained on trauma-informed research and trauma-informed programming. It was not particularly specific to PASS per se, or do you want to say more about it, Elsa? Sure. What the idea was?
Yeah. I think just recognizing from our work, our original work in Benning Terrace, that we tend to hear a lot about trauma-informed service provision. And so there are a lot of trainings out there in terms of training clinical social workers and others who are direct service providers to provide the work and the services that they do in a trauma-informed way. We really wanted to ensure that our entire project was being implemented in a trauma-informed way. And so that meant bringing all of our partners together to the table from the beginning and really talking about a lot of the structural issues that Sue talked about at the beginning of the presentation, and recognizing that we wanted to work in partnership with a lot of communities, that these communities had long histories with research, some of which may have been positive, but a lot of which was not positive. And that there were a lot of traumas that are not even related to the scope of work that we're working on here, but that folks experience every day, and that that they are not going to parse out and experience separately from their experience with us and with the work on this. And so that it's important to provide space to discuss those topics, to find other opportunities, whether it's other research opportunities or discussions at the city level, to be able to continue those conversations, and to really listen to both all partners at all levels, so youth participants, adults from the community-based organizations that we're working with, the Housing Authority, and everybody's input to ensure that those histories and past experiences were being incorporated into our project approach.
Great, and I guess the one last thing that I want to add that just came up for me was thinking about coercive sexual environments in the context of what experiences individual girls or young people are experiencing themselves, but also the trauma related to vicarious victimization. So knowing someone who was raped or sexually harassed, or knowing someone or witnessing someone be sexually harassed, how that can have a vicarious victimizing experience that is related to trauma as well. So please share questions with us as you feel you have them. We do have a couple up here. And so One I wanted to address it was asking about boys being included in PASS as well as girls, and we do have 2 programs as was mentioned earlier, but in case you missed it, there's 2 curriculums, one called Sisters Rising and the other one called Brothers Rising, and they address similar topics across the board related to sexual health and safety. Do you want to say?
Yes, and the boys and the girls meet at the same time for the 10-week period, but just on different days.
Okay, and this one is for Tia. What type of cross-learning has gone on during the course of this project in terms of what have the researchers learned about working with young people in the community, or in terms of what have the community has learned about doing research? So we can...
From the community point, working with a researcher, they learned that everyone is not coming in there just trying to get information and stuff from them and then take it somewhere else and it's being utilized. So that was a good learning experience that me and along with the other community members learning to trust researchers and stuff. What was the other one?
It was from our perspective, what did we learn from the community?
I guess I could speak on that, but I guess they also learned that working with the community, they could get more done and more outcomes and better resolve dealing with the people in the community that y'all are trying to get data from.
I guess I could throw in that I mentioned the teen food program. We knew food insecurity was sort of a problem in public housing, but we thought, based on other research I'd been doing for a long time, the big material hardship people were facing was utility payments because the payment for utilities was changing. And when we started doing this project, it was the adult advisory board for this project that told us about the kids and food insecurity and how that can put kids at risk for risky behavior and the kinds of negative outcomes we're talking about here too.
And sexual exploitation.
Sexual exploitation.
Related to food insecurity in particular.
And other kinds of risk feeling, all kinds of things. And I think it's something that if we hadn't built the relationship with the community, people wouldn't have told us because there's so much stigma associated with it. And kids will not talk about it. We now know from trying to talk to them about it, very reluctant to talk about it. So I think the importance of building those relationships and taking that time and showing up, as Elsa said, also shows up a lot, and being willing to listen, I think really makes a difference in what you're able to learn about what's actually happening and what people need.
On the ground, yeah. And food insecurity is a real big one, and don't seem like it's going nowhere. I mean, because, you know, we give kids stipends, which is nothing but $10, not a lot, but it's a lot to them. But it's usually like towards the end of the sessions, we try to give them an extra gift card. And dealing with 30 kids, I've had probably half of them thinking that they're just getting a gift card, not getting the $10, so they would say, I don't want the gift card, I just want the cash, so they go and buy some more food, even though we feed them each session. So, you know, even though they're getting both, but that does play a big part in stuff.
And I don't think we mentioned that we feed them each session.
Yeah.
That's an important piece. We feed them each session. And there's also, in between surveys, we've also had sort of, what are those events called? The coming back together events.
The reunions.
Reunions. There's reunions of the youth in the program, and that will feed them and do some fun activity.
And also what I do like, what I have learned, and also what, I guess because I did work closely with Elsa and Sue and them, is that once I come to them and we have an issue that's going on in our group with one of the girls or boys, I come back, I talk with Elsa and them, and they always trying to find the resources, even for the co-facilitators, because there's a lot of trauma that these kids have on a day-to-day basis and stuff. So that's the most pleasure part about it for me, is that we both learning from each other, and it's moving forward and it's growing. So I just wanted to say that. Okay.
And one of the things I found really interesting during the data walk was that we presented the baseline survey information across the sites on the teen dating violence measures, and so that included physical violence, cyber dating abuse, sexual coercion, and other forms of psychological abuse. And just the reaction from the community members and the program providers about the levels of teen dating violence youth have reported experiencing at our first survey was really interesting, and just they were on one hand surprised to see the numbers, but also on the other hand not surprised because of hearing about it through the youth and from the youth during the sessions. And so just being able to actually provide them with that information and say, see, this is what kids are saying. So,
and just to kind of piece that together with another question that came up earlier about what young sexual assault victims can do based on what we know about TSE's in the past work, I'd say to tie everything that we talked about today together is because a lot of the structural issues that we mentioned, there's a lot of mistrust and distrust in institutions that youth would need to rely on in order to respond to something they might be going through or help a loved one or a friend respond to that. And so one of the things that we really try to make sure happens is that kids don't just receive a phone number, they're not just taken to a health clinic or a rape crisis center or, you know, told to call the police or things like that, that they're, over time as we're implementing the project, we're making sure that these folks are coming on site and that they have contact with an actual live human that they've met before, they know there's a name there, there's a personal connection that can be made for them to really feel comfortable accessing those things. And one of the things that we're actually incorporating at Benning, where we're, like I said, constantly revisiting and revising the program model, is to have somebody come out, a police officer in this case, but it depends on the moment, come out and talk to the kids about, if you choose, this is something you can do to respond to this particular situation, and this is something you can do to respond to this particular situation, and this is what's going to happen afterwards, so that they can really make an informed decision about how they choose to respond to their particular situation, and not feel surprised down the road or not opt to do nothing because they don't know what's going to happen next.
Okay, I think that wraps up the questions, and I do see someone saying they're hearing music, so they don't hear us over the music. I'm not sure what that is about.
Janine, actually, we did have another question, and I want to encourage people to continue entering your questions into the chat field. While you do that, we are going to go ahead and open up our closing poll so that people can be sure to give us their reactions before they depart for the day. But we did have another question earlier, which is, have you all worked with the local domestic violence coalition as part of this project? We know many of them are working on issues regarding public housing and the barriers that single women and their children face. And so we were curious about whether you're involving them.
We haven't up to this date, but we are aware of, you know, current research going on around public housing and domestic violence survivors having issues of staying in public housing because of nuisance complaints. And so I don't know if you want to say more about that, or?
I actually think the big focus on public housing, sorry, I just actually got distracted by breaking news that I'm going to have to get pulled into, but Secretary Carson just announced work requirements and rent increases for public housing. So that is the focus for the people in the public housing research world right now, is trying to hold on to the safety net.
Yeah.
And then I think, but there are a number of housing authorities that we do work with who are thinking about things like services and supports and how to, and that's the other project that Elsa mentioned, this project stemmed from, the HOST project, is incorporating services into public housing communities so that people who, whatever their problem is, domestic violence or food insecurity or health, can get help and get access to help quickly.
And we do provide resource cards to the youth who are in programming, and so those are local sexual assault, domestic violence, and suicide prevention programs that they actually receive referral cards, yeah, like the DC Rape Crisis Center and that kind of thing. So youth are given referral sources on a routine basis, just in case. They don't have to ask for them, we just do it. We give them to everyone so no one feels strange about getting a referral. They just all get the same information a few times throughout the process.
But I think that one of the key things that we've learned through all of this work is, I'm going to go back to what Elsa and Tia said about the importance of relationships. People will not use that card unless they feel like somebody who they can trust And one of the reasons that we do host and pass and other work we do about bringing people into the communities is to help build that trust and make that connection, because people know there is so much stigma associated with living with in public housing. And I guess I'm reacting to today's news because that's what that is about too. And they really need to feel like someone is going to listen to them, hear them, be there for them in the long run.
I mean, that's the good thing about us, community workers, is that we network, and the people that we deal with on a day-to-day basis, other providers, service providers inside or outside of our neighborhood, I have communications and good contact and relationships with them, so I'm able to call them when one of our youth are having, you know, some difficulties and ask them for advice or, you know, for services, and the youth trust that because it's us, we offer, you know, than them just calling someone on their own.
Okay, great. Thank you. Susan?
All right. Yes, thank you all so much. This has been fascinating and also very inspiring. I feel really hopeful that great work is being done for so many of the girls who've been missed, I think, from some of our existing services. And it's really exciting to see what researchers and practitioners can accomplish when they really bring the community members in as full partners in these projects. So I want to thank all of you for the time that you spent sharing your lessons today. And thanks to everyone who joined us for this webinar. Please do take a moment to fill in our closing poll. And if you have any additional questions for the panelists that you didn't think to ask in time, send them to us after the session, and we will distribute any remaining questions and answers when we send out the link to the recording. So thanks everyone for joining us, and we'll see you at the next webinar. Bye-bye.